Good afternoon, everyone, and thank you all for joining us today. Welcome to the FNIM Data and Indigenous Data Sovereignty webinar. This is a two-part webinar series, with part one discussing recognizing the harmful effects of historical research and building trust with Indigenous communities. We'll get started in a moment, but first we can get a few housekeeping items out of the way. Microphones are muted by default, but should you have any questions, please feel free to type them in the Q&A function and we will answer them, as we have allotted time for a question and answer period at the end of the webinar. If you wish to ask your questions directly to the presenters during the Q&A period, feel free to use the raise your hand feature and you will be unmuted to speak. Please use the chat function for technical assistance and one of our team members will be able to help you out. Let me start off today by introducing myself. My name is Rachel Brown and I'm the Communications Coordinator here at IPHCC. And today we have the pleasure of delivering this webinar in partnership with Poplar. As I mentioned previously, this is a two-part webinar series, and part two will take place on May 10th at 12 p.m. Anyone who has not registered for that and would like to, the link is going to be provided in the chat. Today we have from the IPHCC, Dr. Nicole Blackman and Dakota Recollet. Dr. Nicole Blackman is the Director of Integrated Care and Clinical Services at the IPHCC. She also has over 14 years experience working in leadership positions with an Indigenous focus, including Director Professional Practice for Winnebago Area Health Authority and the James and Hudson Bay region of Northeastern Ontario, Indigenous Lead at the Durham Region Health Department, and the Health Director for the Mississaugas of Scugog Island First Nation. Dakota Recollet, who is the Director of Cultural Safety here at the IPHCC, oversees the direction to provide support and training for individuals working in the healthcare system to learn the importance of adopting culturally safe and appropriate practices to ensure the best quality of care for Indigenous peoples. With that said, I'll turn it over to Nicole to get started.
Miigwech, Rachel, for the warm introduction. We also want to thank Poplar and the Alliance for the partnership and collaboration on the webinar series. And we want to thank all of the attendees joining us today. So just to start, for those who are not aware of what IPHCC is, the Indigenous Primary Healthcare Council is an Indigenous governed and Indigenous led culture-based organization. And we were established to support the advancement and evolution of Indigenous primary healthcare services across the province. We use Indigenous solutions to transform Indigenous health outcomes and decolonize health systems. And we do this by empowering the voices of Indigenous peoples and communities to affect change, by partnering with Indigenous communities, as well as mainstream organizations and government agencies. We also gather and share data about the health status of Indigenous peoples and inequitable service gaps, while addressing strategies to address those gaps. And we equip council members with the tools and training and networks provided to support with them with providing culturally safe and quality healthcare. IPHCC is a member-based organization, and we have 21 members located across the province. And collectively, they're known as the Indigenous Primary Healthcare Organizations, or IPHCOs. And this includes Indigenous Community Health Centers, Aboriginal Health Access Centers, or AHACs, family health care teams, Indigenous interprofessional primary care teams, and we have one member that is a nurse practitioner-led clinic in Thunder Bay. So for the first webinar series, as Rachel mentioned, we're going to focus on the history of research in Indigenous communities, recognizing the harm that's been done, as well as the importance of building trust and understanding what meaningful engagement and collaboration means from an Indigenous perspective. The content from today's webinar will set us up for the second webinar in the series, which will be held on May 10th and hosted by IPHCC CEO Caroline Lidstone-Jones. The second webinar will look at the impact of the knowledge that's shared today and application to practice. So with that being said, let's get started on our journey. So in 2015, the Truth and Reconciliation Commission of Canada released its report titled Honoring the Truth, Reconciling for the Future. And that identified 94 calls to action, as well as highlighted the importance of research to advance understanding of reconciliation. 10 principles of reconciliation were provided, notably that reconciliation requires constructive action on addressing the ongoing legacies of colonialism, and that reconciliation requires political will, joint leadership, trust building, accountability, and transparency, as well as substantial investment of resources. In 2018, the federal government committed $3.8 million to one of the largest national research granting agencies to support development of a strategic plan that would identify new ways of doing research by and with Indigenous communities. And this included strategies to grow the capacity of First Nation, Inuit, and Métis communities to lead their own research and partner with the broader research community. This has not been the typical approach that research has taken with regards to the Indigenous population. Historically, the approach to research has been top-down, and Western knowledge has been seen as superior. Indigenous knowledge was often disregarded. It was also believed that conventional research practices could be used in research with structurally marginalized groups. Historically, research was conducted under the control of outsiders or the researchers, and Indigenous people and communities were not provided and were oftentimes denied the tools that were required to assert their own knowledge. This is evident by researchers discounting the capabilities of Indigenous people and communities and perceiving them to be in need of paternalistic control. This research ideology, which is thought to have advanced the politics of colonial control, put knowledge attainment before the interests or needs of the people that were being studied. The history of research on Indigenous people and communities is a complex and often painful one. It's intertwined with colonization and the attempts to assimilate and control Indigenous peoples in their land. From the earliest form of research that used Indigenous knowledge to aid European explorers, to the more recent efforts to decolonize research and center Indigenous perspectives. The history of research on Indigenous peoples in Canada reflects the broader historical and ongoing struggles for Indigenous sovereignty and self-determination. One of the earliest forms of research on Indigenous peoples in Canada was the use of Indigenous knowledge and expertise to aid European explorers in navigating the land and surviving in harsh environments. This included learning from Indigenous peoples about how to hunt, fish, and gather food, as well as how to build shelters and navigate through unfamiliar terrain. However, this early research was often exploitative and did not recognize or value Indigenous knowledge and expertise on its own terms. In the late 1800s and early 1900s, the Canadian government implemented policies through the Indian Act, and that included through the residential schools system, Indian hospitals, child welfare interventions, and these were aimed to assimilate Indigenous peoples and strip them of their culture and traditions. Implementation of these policies, along with others, had long-lasting effects on Indigenous peoples and communities, particularly with regards to their mental, emotional, physical, and spiritual health and well-being. During this time, many researchers studied Indigenous peoples with the goal of proving their supposed inferiority and justifying colonial policies. These group of researchers included anthropologists, sociologists, and other social scientists who conduct studies on Indigenous peoples and communities without their consent or participation. The history of research on Indigenous people in Canada is fraught with examples of harmful and exploitative practices. One of the most egregious examples is the use of residential school children in medical experiments without their consent and without the consent of their parents. These experiments included administration of experimental vaccines and the withholding of adequate nutrition and medical care, which resulted in lasting harm to many Indigenous children. We look at drug testing that was done at a residential school in Kenora, where they tested experimental drug on children with ear problems, and that resulted in permanent ear loss for many Indigenous children. Then we also look at the trial of the TB vaccine that was done on children in residential schools, as well as nutritional research that was done. The nutritional research experiments were designed to test the effects of dietary interventions on malnourished children, as so many children who attended residential school were. At some schools, children were given vitamin-enriched flour, which was not yet legal in Canada. At other schools, vitamin supplements were provided. And in some schools, the milk ration was tripled to see whether it had any noticeable effect on the low vitamin levels of students at the school. Students had occasional blood tests and medical examinations to test this. It's felt by the Indigenous community that residential school students were choosing to be test subjects for a number of reasons. First, they were wards of the state, and as such, the government had control over much of their lives, and their parents did not. Second, the fact that they were already malnourished made them good candidates for nutritional research. And third, given that these children were not white, they were seen as ideal subjects to a certain extent from perspective of scientists. And this may be a contributing factor to why we see pushback from Indigenous people and communities when studies focus on vulnerable or structurally marginalized groups. With the nutritional testing, there's no evidence that researchers ever tried to get parental consent for these tests. And it's not that consent wasn't done at the time of the experiments, because researchers did get consent from another similar school trial that was done a few years earlier, where the effectiveness of a free lunch, school lunch program on Indigenous health in Toronto's Moss Park neighborhood was conducted. But in that case where consent was sought, students were non-Indigenous. We mentioned that the TB vaccine was tested on children in residential schools, but it was also tested on children in Indian hospitals. In the early 1930s, Dr. R. George Ferguson began his 12-year BCG vaccine study on patients at an Indian hospital in Saskatchewan. The study was approved by Indian Affairs and funded by the National Research Council, and it began as an experimental vaccine trial on local Indigenous infants. The study was an apparent success because it only had 6 of the 306 children in the vaccinated group developing TB and 2 deaths, while 29 of the 303 children in the control group developed TB and 9 died. Ferguson's research also revealed that 77 of the 609 children in the trial, more than 12%, died before their first birthday, while only 4 of these children's deaths were related to TB. 2 were in the vaccinated group and 2 were in the control group. In all, nearly 1/5 of the children in the trial died from other diseases, mostly from gastroenteritis or pneumonia. Poverty posed the greatest threat to these children, but unlike TB, it did not spread to non-Indigenous communities. So while the BCG vaccine lived up to its promise to control TB, it left the socioeconomic conditions that led to its rise untouched. There are also examples of experimental treatment that was done for TB in hospitals. Records were poorly kept, but some patients speak of having a lung removed, which involved having sections of their ribs connecting to their spines cut off. And this operation was routinely performed with just a local anesthetic. And others report having doctors operate on them and removing part of their lungs as a treatment for TB well after antibiotics had become the standard of treatment. Other examples of research-related harm is the misuse of blood samples. So for example, some samples were taken from Indigenous communities to test for diabetes, but they also used it to test for genetic schizophrenia. Other samples were taken with the intent to explore high rates of arthritis in the population, but they were used to determine ancestry. In many cases, blood samples that were taken were sold or given to other researchers for unknown use and without permission. There's also an example of research-related harm with accessing data without permission. One example is in Labrador, where a researcher accessed local suicide statistics without permission and presented the findings at a conference and never to the community. Some other harmful research practices is misconception of voluntary consent. And this was when Indigenous research was funded by governmental agencies who also controlled resources to which the communities depended on. So as a result, many Indigenous communities were fearful to refuse consent for participation in research in fear that the funding for their essential resources would be taken from them. There was also apathy towards Indigenous priorities. Researchers determined subjects and research topics of their own interests or interests of the larger society, with little to no concern for the needs of the community. There's also limited to no community involvement. Even when researchers expressed community involvement, oftentimes they came into the community with their research plan already developed and funded, which demonstrated 0 levels of true collaboration. They did not seek approval with interpretation, so researchers would analyze, interpret, and report on Indigenous data without consent, approval, input, or review from the Indigenous communities or representatives. There is unreciprocated compensation, so researchers would profit professionally and economically from Indigenous research, but did not employ local people nor offer compensation to research subjects. There is also a common practice of helicopter research, which is where researchers would come into the communities and conduct their research, without meaningful engagement or consultation with community members. This often led to research that was irrelevant or harmful to the community, perpetuating the historical exploitation of Indigenous peoples. Many times there is lack of cultural safety or appropriateness with the informed consent process. Oftentimes consent was not presented in language or manner adequate to fully understand informed consent. There were significant issues with confidentiality, as researchers did not always protect the confidentiality of Indigenous participants or communities to the same degree that they did with non-Indigenous participants. There is a disrespect of basic human dignity, particularly in relation to spiritual or cultural beliefs. There is conducted research, genetic research that was demeaning to Indigenous dignity, as evident by the examples shared. There's also presence of alternative motive, as evidenced through the misuse of blood samples, where the researchers tried to establish ancestry with the intent to use it against the Indigenous population by attempting to prove that they were descendants from other areas of the world. There was theft of human remains and cultural property, taken without permission for storage or display in museums or made for sale. As well, scientists and collectors thought skulls, bones, and skeletons to research theories about race, evolution, and human history. There's been inappropriate commercialization. So often data provided by researchers was distorted and treated as a commodity. So for example, Indigenous stories have been used for books, movies, etc. In addition, governmental researchers have collected information about traditional remedies and marketed them for profit. And something that still takes place today is having a deficit-based approach to the research that's conducted. Research continues to focus on the problems, and what that does is, instead of looking at the strengths of the community, it further perpetuates negative stereotypes about the population and communities. For many Indigenous people and communities, research is considered a harmful word. Research is linked to a history of colonization, and there are ongoing concerns of further attempts of assimilation. Cultural designations are rarely used. FNIM are lumped together as Indigenous with no differentiation or appreciation for the uniqueness and difference among and within First Nation, Inuit, and Métis. In quest for knowledge, it's thought that researchers quote out of context and don't give anything back to the community, which has added to feelings of mistrust towards research and researchers. Indigenous communities have gladly shared their stories and provided hospitality to researchers in the past, but they felt as though they were taken advantage of when they would take what they want and then leave. There was a sense among Indigenous communities that the population has been researched to death, and the sense continues today. This is particularly relevant when the research fails to be relevant to or applicable to the participants or to the community. When it comes to ethics and consent, it's felt as though just because researchers go through ethical reviews at their university settings, it does not mean that the research is ethically appropriate for Indigenous communities or meets the need for Indigenous community approval. And it's also felt that when Indigenous ways of knowing and positivist scientific thoughts collide, that it's jagged worldviews that are colliding. And before I pass it over to Dakota, I'm just going to quickly go through the timeline of research in the Indigenous population. So in 1876, the Indian Act was passed in Canada, and it gave the federal government control over many aspects of Indigenous people's lives, including their healthcare. In the 1920s, medical researchers began studying Indigenous people's health, often with the goal of identifying supposed genetic or cultural factors that contributed to their poor health outcomes. In 1928, the Indian Health Survey was conducted, and it collected data on the health status of Indigenous peoples. And that data was used to justify funding for medical services in Indigenous communities. In the 1930s, the Canadian government began conducting medical experiments on Indigenous children in residential schools and Indian hospitals, including what was mentioned of the experimental vaccines and inadequate nutrition and medical care. In the 1970s, Indigenous peoples began challenging the exploitative research practices, which led to the development of the OCAP principles, so specific for First Nations, that includes ownership, control, access, and possession. In 1974, the National Indian Brotherhood, which is now known as Assembly of First Nations, released a report that highlighted poor health outcomes and called for greater control over healthcare delivery in Indigenous communities. In 1986, the Canadian Institute of Health Research was established, which funds health research in Canada, including research on Indigenous health. In the 1990s, research started to shift to be more collaborative and community-based, and researchers began working with Indigenous communities to identify their health priorities and strengths. In 2000, the First Nations Inuit Information Governance Center opened, and the intent was to ensure research in Indigenous communities was done in a respectful and ethical manner. And then in 2010, the CIHR established the Institute of Aboriginal People's Health, again, with the intent to support research that was done in a respectful and relevant manner to the Indigenous population. And I will hand it over to Dakota.
Miigwech, Nicole. Sorry, I'm muted, guys. Thank you. Indigenous resistance and self-determination. So despite the ongoing impacts of colonization and assimilation policies, Indigenous peoples in Canada have always resisted and fought back against these injustices. And this includes resistance through cultural practices, political organizing, and legal challenges. In recent years, there has been a growing movement to decolonize research and center Indigenous perspectives in all aspects of research on Indigenous peoples. This includes recognizing and valuing Indigenous knowledge and expertise, as well as acknowledging the ongoing impacts of colonization and working towards Indigenous self-determination. So challenges and opportunities for decolonizing research. Decolonizing research on Indigenous peoples in Canada is not without its challenges. Researchers must be willing to confront their own biases and assumptions and work in partnership with Indigenous communities to ensure that research is respectful, ethical, and beneficial. However, there are also many opportunities for decolonizing research, including the potential for greater collaboration and understanding between Indigenous and non-Indigenous peoples, and the possibility of creating new knowledge and ways of knowing that are grounded in Indigenous perspectives and worldviews. So just including a pretty significant quote here by the Honorable Kirsty Duncan. So First Nations, Métis, and Inuit in Canada have been kept on the sidelines of Canadian research too long. So moving forward, some things that we can do to build and maintain trust with Indigenous communities, which is crucial for conducting ethical and successful research. The following are some guidelines that can be considered through this work. Recognize the diversity of Indigenous communities. Indigenous communities are diverse in terms of their culture, language, and history, and it is essential to respect these differences and not treat all communities the same. Build relationships with Indigenous communities. So before starting any research, taking the time to build relationships with the community, which could involve attending community events, engaging with community leaders, and seeking guidance from elders or knowledge keepers. Prioritizing the community's needs. Research should be driven by community needs and priorities and not just the interests of the researcher. Ensure that the research aligns with the values, goals, and aspirations of the community. Obtain informed consent. So obtaining informed consent from community members before starting any type of research. And this involves providing all information about the research purpose, risks, and benefits, and the right to withdraw at any time. Using a collaborative approach, so involving community members in all stages of the research from design to dissemination. And this ensures that the research is culturally appropriate and aligns with the community's priorities. Respecting Indigenous knowledge and intellectual property. So recognizing and respecting that Indigenous knowledge and intellectual property and being sure to cite and acknowledge that in an appropriate and safe way and taking that lead and guidance from the community. Ensuring confidentiality and privacy. So protecting the confidentiality and privacy of community members, using appropriate data collection and storage methods, and obtaining permission before sharing any type of data. Providing feedback, building capacity, and follow-up. So providing feedback to the community about the research findings and how this could benefit the community. This ensures that the community is informed and that the research is transparent. Building capacity within the community to conduct research independently. This ensures that the community has the skills and knowledge to lead research that aligns with their values and priorities. And following up after the research is complete ensures that the community is informed of any follow-up studies and provide ongoing support to the community where it is needed. And adding to that, meaningful engagement and collaboration with communities is also crucial as part of research. And it involves building relationships based on mutual trust, respect, and understanding. These are some key principles or wise practices that you can follow. So just as with building and maintaining that trust, relationship building is also a big part of the meaningful engagement and collaboration. Indigenous peoples value relationship building as the foundation for meaningful engagement. And it should be ongoing. It should involve building trust and relationships and ensure that it is beyond the scope of the research project. Community control. Indigenous peoples believe in community control and self-determination. So meaningful engagement and collaboration must involve empowering Indigenous communities to lead the research, set priorities, and make decisions that align with their values and interests. Reciprocity. Indigenous peoples value reciprocity and believe that engagement and collaboration should be based on a mutual benefit. So research must benefit the community in meaningful ways, such as by providing opportunities for capacity building, improving health outcomes, and preserving cultural knowledge. Cultural safety, which involves creating a safe and respectful environment that is free from discrimination and racism. Engagement and collaboration must be culturally appropriate, and researchers must understand the cultural context in which the research is conducted. And finally, a two-eyed seeing approach. The concept of two-eyed seeing is something valued by Indigenous peoples, which involves integrating Indigenous and Western ways of knowing. So meaningful engagement and collaboration should draw on both Indigenous and Western knowledge systems and involve Indigenous knowledge holders in the research process. So the following few slides will just be a few teachings that can help provide some context into what coming at this work from an Indigenous lens may look like. So just providing some information on the 7 sacred values, which is also known as the 7 grandfather teachings, can be useful stepping stones to creating a wise practices framework for researchers to embed in the own work that you do. These values may differ slightly across Canada, but the intent is much the same: to think, reflect, and choose before you speak or act. So courage, to speak, to reveal, to reach out, to be open, and to be introspective. Honesty, to know yourself and your own values, biases, and beliefs, and to speak from the heart and soul, and to allow yourself to be seen, known, and heard. Humility, so we are all in this in together and all have an inherent value, and no one person is greater than any other. We are all ordinary and extraordinary beings, and our greatest task is to learn to be of service. Respect, coming together and honoring our place and space, knowing that it is something you must give to get, and honoring the smallest to the oldest. Truth, knowing our truth is not the only truth, and there are many paths. No matter how much we learn, there is much we do not know. Love, unconditional acceptance of self and other, and accepting and embracing difference, allowing and gracefully being giving of everything we are. And wisdom, providing an expansive and inclusive view of the world. So these teachings and stages are not exclusive or final, and each one has something that enhances and illustrates the others. In order to understand the underlying principles of wise practices, it is important to understand how these values guided people throughout their lives, how they can be expressed as tools for change, and where they might impact community morals today, and how they can potentially transform practices. And again, the following 2 slides are just some stories that can give some additional perspective to how Indigenous peoples follow some of this work. So the hawk and wolf teachings. The hawk is a teaching, there is a story associated with it, but it's a little bit longer. So just keeping in mind that the hawk can see everything, and it reminds us to take a wider view, understand the history of colonialism and how it impacts Indigenous peoples and populations, and open up ourselves to new knowledge systems as they are gifts. And the wolf teaches us humility. So the wolf reminds us to overcome failure. There will be challenges in relationships that will sometimes result in failure, and the key is to learn from these mistakes. Be good citizens as you are a guest in communities. Be humble in your relationships and listen and learn to communicate carefully. And finally, just giving a bit of insight into ethical review committees, which are composed of Indigenous people and operate within Indigenous communities. And so there are many communities throughout Ontario that have their own ethics review boards. They are designed to ensure that research conducted with Indigenous peoples is conducted in a culturally appropriate and safe way. They may be composed of elders, knowledge keepers, community members, and researchers themselves within the community. They have a number of functions, including reviewing research proposals, providing guidance, ensuring community consent, protecting community interests, and upholding ethical standards. It is important to note that Indigenous ethics review boards are not a one-size-fits-all, and different communities may have different approaches. And on the following slide are just some examples of Indigenous ethics review boards in Ontario. It's important to note that this is not an exhaustive list. There are others throughout Ontario, and as I mentioned, a lot of communities do actually have their own right in the community. And finally, we do have some time. So I just want to share a video. The playing time is about 8 minutes, but this video does speak to how research and data collection is more than just numbers. And for Indigenous communities, storytelling is a very integral part of our culture. And so this video is an individual that speaks to storytelling and how that is relevant to research for Indigenous communities.
I call myself a storyteller for health. As an individual who's been involved in research for the past 8 years, it was something that was a little bit difficult for me to come into. It was a structure that was built on very Western ideas of who Native people were and what health interventions were going to reach them the best. It was a struggle for me to find my place in that institution because I really felt who I wasn't fitting in there. An uncle of mine, 3 months after starting working for the university, told me a story that really shaped who I am and what I've done within the research world. He told me this story of him as a little boy. He had been given some kind of toy. He had no idea what it was, a little sack. And in this little sack were these little glass, shiny, round things. He didn't know what they were. And he played with that little sack and he tossed it in the air and he threw it around and made these cool little noises as those little round things kind of bumped into each other. So a couple days after he got that toy from some missionaries who had come to his village, his mom had sent him to go get firewood. He lived in very rural Alaska. And as he walked to the stream where he was supposed to be getting his firewood, with his feet crunching on that white, crunchy snow, he walked across the stream, and in my village, the stream is still running at 30 below zero because it's coming from a glacier. It's just ice cold. And he stood over that stream and he dropped these little round things from this little sack that he'd had, and he dropped them into the water one by one. And he said they made the most beautiful sound, just this little ping, ping. And at the end, he looked and all he had left was this little sack in his hand. All of the little round glass things were now at the bottom of the creek, and because it was so cold when he dropped them, it barely made the tiniest of a ripple. And so he walked back home. So other than being the best story about how my uncle lost his marbles, it really illustrates the point of individuals bringing interventions, research studies into our communities with no knowledge of who the community is. And so instead of these interventions would have such strong promise, marbles are a great game to play. But if you don't know how to play the game, and if that game isn't applicable to who you are or where you're located, all you get is a tiny little sound and maybe the smallest ripple. And that's where I saw myself and then the strengths of other Indigenous people working in research to be coming in to change that story, to look at how do we engage individuals, tribal communities, urban Indian communities into research that truly serves their need. And what that means is we go in with an open heart, and we go in with humility and compassion and understanding that we don't know what that community needs, they do. And the only way that research and health interventions are going to have the strength to actually make community change, we have to start knowing, understanding, and engaging people in the stories of their community, of how these interventions can serve them the best. Unfortunately, in our communities, American Indians and Alaska Natives experience morbidity and mortality from diseases that we're also familiar with: diabetes, heart disease, cancer. Instead of we're seeing these numbers decrease, we're actually seeing them widen. And even that, our incidence of these is higher than the general population. Our research and the way that we operate has to change. We have to be thinking about the research and the data as part of the stories that have been passed down to us from generation to generation. Who are we and where are we in telling that story, in shaping the landscape of who Native people are going to be in those future generations? How do we share that story? How do we build evidence for these evidence-based practices that actually have our evidence in them? It is so important for us to be not only part of the research world like myself, involved in and working for and directing a university program, but also as communities engaged in the research world where we are directing how the research is conducted in our land, ensuring that the topics that are being done are of benefit to our community or to the larger Native community across the country. How do we do that? It's really standing side by side with other researchers, with other communities, with each other, hand in hand, instead of competing against each other for the limited funds that the federal government puts forth for both research and for health interventions. And I know this is all kind of pie in the sky, wish world kind of thinking, but we have to think that way. We have to change the narrative of what health is, how we define, how the general United States and most of the world defines a healthy individual. It's based off of a middle-class white man. I want to have the health of a Pawnee Athabascan woman who is a mother, a daughter, a granddaughter, a community member. That is the health I want to see, and that is the health that I want to build for my community. And that makes us have to redefine what equity is, how we're going to reach health equity, and how we need to define health for our communities. And that is a community level conversation, that is a state conversation, that's a national conversation for us to have. And research, the ability to use those Western systems, but base it in Indigenous knowledge and Indigenous strengths and Indigenous methodologies, is the way that we're going to change and shift this narrative. And again, it has to have Indigenous Native people as part of that conversation. So at the end of the day, who do I want to be? I want to be that mother, that daughter, that wife, that granddaughter. I want to be that community member. And I want to change the narrative of health by telling the stories of our communities that show resilience, humility, love, compassion, and most of all, hope. Hope for the future, because we're going to change this story, and we're going to pass down those stories to the next generations to build that stronger health for community. I just want to tell a story.
Thank you, Nicole. So sorry, I'm just turning my volume down here. So setting new directions to support Indigenous research and training. And a lot of this we touched upon in the presentation itself. As you can see at the core, we have strengthening Indigenous research capacity, which involves building relationships with First Nations, Inuit, Métis people, championing Indigenous leadership. As you heard in the video, not so much creating greater funding accessibility, but to avoid this fight for funding that is available, which involves working together and collaborating in these areas, and supporting research priorities of Indigenous peoples. So in conclusion, the history of research on Indigenous peoples in Canada is a complex and often painful one. Sorry. But it also has a story of resilience, resistance, and hope. And as we continue to grapple with the legacies of colonization and work towards Indigenous self-determination, it is essential that we center Indigenous perspectives and knowledge in all aspects of research. By doing so, we create a more just and equitable society that recognizes and values the diversity of Indigenous peoples and their contributions to our shared history and future.